The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with Inside JACC, and today I'm talking to Dr. Sammy Elmariah, and Sammy is on the staff of the Massachusetts General Hospital, and he's the first author of a very interesting paper we have in JACC that deals with the use of biphosphonates in women and the potential for valvular calcification. Sammy, can you tell us the nature of your study?
Sure, I'd be happy to. Well, there's significant experimental evidence suggesting that bisphosphonates may limit vascular and valvular calcification. So we use data from the multi-ethnic study of atherosclerosis, or MESA, to determine the relationship between bisphosphonate use and calcification at the aortic valve, the mitral annulus, the thoracic aorta, and the coronary arteries. What we found was that there's a very remarkable interaction with age in terms of the relationship between bisphosphonate use and calcification, such that in elderly subjects, those over the age of 65, we actually found that there was a dramatic reduction in the prevalence of cardiovascular calcification with bisphosphonate use. Whereas in the younger subjects, we saw the exact opposite, a marked increase in the prevalence of cardiovascular calcification.
Now, why should bisphosphonates, in fact, do anything to valvular calcification?
Well, there's actually a couple of hypotheses. The first is that bisphosphonates act on the mevalonate pathway, a few enzymes downstream of HMG-CoA reductase. So they do have several statin-like effects. They have an effect on lipids. They also have an anti-inflammatory effect. They've been found to inhibit matrix metalloproteinases, as well as several other mechanisms by which they may modulate vascular and valvular calcification. Having said that, some do hypothesize as well that simply by inhibiting bone resorption and the release of calcium phosphate particles, that perhaps this has a beneficial effect on vascular health as well.
Now, I must admit, as we read the paper, we were mystified by the fact that bisphosphonates would be protective in women over the age of 65, but associated with enhanced vascular calcification in those under age 65. Do you have any explanation for this?
We have a few. To be honest, it's a little bit difficult to truly come up with a great explanation given the data within MESA and the limitations of the data set. Having said that, we do have a few hypotheses. The first is that, as you know, bisphosphonates are prescribed for low bone mineral density. Low bone mineral density has been associated with increased cardiovascular calcification. So perhaps in those younger subjects, bisphosphonates is acting as a marker of those at higher risk for cardiovascular calcification on the basis of their low bone mineral density. And with age, presumably, and with prolonged duration of use, we start to see the putative benefits of these agents. But of course, there is the possibility that a true age-dependent mechanism does exist, although to be honest, we've not been able to come up with a biologic reason why this may be the case.
You wouldn't withhold bisphosphonates from women under the age of 65, would you?
Absolutely not. And I think for a woman to be prescribed a bisphosphonate at such a young age, there's also the potential that she has either a more aggressive osteoporotic process or perhaps another disease entity altogether that's putting her at high risk for vascular and valvular calcification. But again, I absolutely would not withhold these agents.
Well, very interesting data on a very commonly utilized medicinal therapy in women and some potential insights into mechanism and possible targets. Thanks very much. For Inside JACC, I'm Tony DeMaria.